17 or 18 years ago, I was still a resident in psychiatry working in Beth Israel Medical Center in the Lower East Side of Manhattan. Now, that hospital has a pavilion called Bernstein Pavilion. On the 7th floor, at that time, there used to be a medical unit specially for medical problems caused by drug use. It was a little bit like the backstage of the drug scene, and it was meant to treat the wounded actors on this drug scene. Very interesting medical unit. It was not manned by psychiatry. It was run by internal medicine. But the psychiatrists, of course, they were called often for consults on that unit. So that's how I ended up in and out of that unit. One day I was called for a consult, and I ran into a group of kids. I'm saying kids because they were pretty young patients there. And these kids were hanging out at the reception area, one of them sitting in a wheelchair. I knew that the wheelchair is always in front of the reception area because no matter if the patient can walk or not, ultrasound or radiology are done by bringing the patient on a wheelchair. So I approached him with the question, is this wheelchair yours? Immediately in my mind, following up with the statement, well, if it's not yours, why do you sit on it? Just go and sit somewhere else. But the youngster, he probably was 23 years of age. He said, oh yes, it's my wheelchair. I was really taken by surprise. What do you mean? Why would you need a wheelchair? I cannot walk. I am paralyzed on half of the body. I was indeed more and more intrigued. How did it happen? He said, a cocaine overdose. Well, he didn't need to say more, because I knew that cocaine can cause this kind of massive problems in the brain. But you know, as a young doctor, you always believe that these might be just hyperboles meant to strengthen the idea that cocaine is bad for you. But now I had in front of me such a case, undeniable in evidence that cocaine can definitely be a very vicious substance. So, what is this cocaine? Why is it so vilified? And what is its history? How did it come to become a star player on the drug scene together with marijuana and heroin and alcohol? And of course, alcohol is a legal drug. Well, so cocaine is a substance which is extracted out of a plant called Erythroxylum coca. Erythroxylum as a genus or a family contains 250 plants which are native to Madagascar and Latin America in the Andean region. But only Erythroxylum coca is a brush which produces sufficient cocaine to be extracted in the production of cocaine. Now, there is also this little footnote. Only the Erythroxylum coca that is grown between 1,500 and 6,000 feet altitude is going to produce enough cocaine to be extracted. The others are just not worth bothering with. So, cocaine has been in use, not cocaine, but Coca Leaves has been in use for a long, long time, over 1,000 years, who knows, maybe more. Why do we know that? Is because we have paintings belonging to the Inca culture showing people using cocaine leaves or coca leaves. How do you know that? Well, when you so-called chew coca leaves, in fact you don't chew them, you make a wad of leaves and you mix in a little bit of lime and you put it between your cheek and the gum. And when you do that, you look like you have a tennis ball or a table tennis ball in your mouth. And that's definitely visible when you see it on a painting. So, before the conquistadors came and changed the whole history of the continent, the Incas used, only the upper class Incas used cocaine leaves. But when Francisco Pizarro came and killed Atahualpa on 26th of July 1553, things changed. He so-called democratized the consumption of leaves of coca, which practically became a habit for many people in that area. Some people who might be inclined to believe, to be a little more cynical or to believe in conspiracy theories, they might say that Pizarro noticed that the Incas did not respond well to incentives like gold, but they will become surprisingly diligent in doing the chores when they were offered coca leaves. So he was the one who is credited with democratizing the use of coca leaves. But the truth is that he was definitely not some kind of a mastermind, evil personality. He brought the coca leaves, who he believed are going to be a hit product in Europe as well. To his surprise, Europe received this product rather with a lot of indifference. Nobody bothered with cocaine for hundreds of years, so practically it was ignored by Western Europe. Why was that? First, there was a problem with spoilage in transit. Coca leaves are very sensitive to humidity, and obviously there's no place more humid as the Atlantic Ocean. And when you cross over with the merchandise, so-called in Western Europe, a lot of the supply just spoils in transit. So another problem was that the practice of using coca leaves is a little bit unsightly. The upper class in Europe felt that it was kind of strange to walk around as if you have a table tennis ball in your mouth. So the habit did not caught on at all, as opposed to the smoking habit, which caught on quite nicely. So we have this cocaine, this coca leaf, and now we have a culture that has been using it for 1,000 years or more, and we have another culture who has been using it for 100 years and has a big problem with it. What is happening? Well, as Theophrastus Philippus Aureolus Bombastus von Hohenheim, or as he is known to his friends Paracelsus, once said, "Alle Dinge sind Gift und nichts ist ohne Gift. Allein die Dose macht, dass ein Ding kein Gift ist." I'm not going to bother to translate it word by word, but in general, what it means nothing is toxic, everything is toxic. It all depends on the dose. So, what does that mean? Well, the traditional use of coca leaves was as follows. You make a wad of coca leaves, you put in the middle a little bit of lime, and then you place it in the back of the mouth, in between the cheek and the gums, and you let it stay there for several hours. This way you get maybe 0.25 grams of cocaine into your bloodstream, which is delivered rather smoothly, rather little by little, in the course of the whole day. When administered like this, whether it has a negative effect on people is rather controversial. So people are doing it because they say that it gives them more energy and it heals a lot of ailments like digestive problems or altitude sickness. And to be fair, very few people who use coca leaves that way are going to become addicted. And also, to be fair, the coca leaves happens to contain a lot of vitamins and a lot of minerals, which would not be available otherwise to the people of the Andean Plateau, where very little vegetation grows anyway. So, we have on one hand Evo Morales, the Bolivian president, who was the president also of the coca growers in Bolivia, defying the public opinion by using coca leaves on camera and not understanding what's the big deal. Why is he taking so much heat from the other countries to stop the production of coca in his country? But on the other hand, we have the Western civilizations who point out what cocaine did to them as a society. And let's see, what does it do, this cocaine? First, you have to understand that the way the Westerners are using cocaine is much different. They use a refined form of cocaine, not coca leaves. They use a quantity of anywhere between 1 to 3 grams or even more. And they do it in a matter of minutes. And when you do that, you have a completely different result. And what kind of result? So let's see. From the moment when cocaine goes into your bloodstream, it gets straight to the brain. And there it has its main action, and that is inhibiting the reuptake of dopamine in the nucleus accumbens. I know you're going to say, what the hell did you say? So let's review. The human being has like an inner compass to make him or her understand what is good to do and what is bad to do for oneself and for the species. This inner compass or reward system is composed of a dual structure, the nucleus accumbens and ventral tegmental area. Nucleus accumbens is somewhere in the orbitofrontal lobe. And what does it mean? Is that part of the brain that sits on the orbit. And the orbit is that part of the bone which lodges the eye. So I think anybody can have an image where that orbitofrontal lobe is and where the nucleus accumbens is. Now you have the ventral tegmental area, which is another nucleus in the midbrain, somewhere between the cortex and the brainstem. So you have this dual structure, ventral tegmental area and nucleus accumbens. It happens that when you stimulate the ventral tegmental area, there is a electric impulse that travels into nucleus accumbens, and them together, when they light up with electricity, they cause people to have this intense feeling of pleasure. They cause people to feel as if they did something good for themselves or for the species. And what are the classic ways in which you have this pleasure? Well, when you eat, when you engage in sexual activities, when other people pat you on the back and say that you do something good. So in these situations, the dopamine is flowing in these structures and you have the feeling of well-being. For some reason, it's like a bad joke. Nature found a way to supply to the human animal with substances that circumvent this natural process and can access the reward system and directly stimulate it as if something good happened for that individual, while nothing good did. And these are the substances called alcohol, tetrahydrocannabinol, heroin, or diacetyl morphine, and finally cocaine. So of course there are many others, but these are the main ones. You have the situation when the person or a human ingests these substances or gets them into their bloodstream somehow, and they have a feeling of having done something good, while in fact they did nothing good, if anything, something pretty bad. Now, to zoom in to the ventral tegmental area and get exactly to the place where cocaine has its action, you have to imagine the following. In the ventral tegmental area, there is the cell, the body of the neuron, the cell body. And then this body has a branch that extends, is very long, can be even 2-3 feet long, but in this situation it's just a few inches long, and it goes from the ventral tegmental area in the midbrain all the way into the prefrontal lobe in nucleus accumbens. And when it reaches that place, it falls onto neurons that constitute the nucleus accumbens, and it stimulates them. Now, how does the stimulation go? Well, it's a pulse of a neurotransmitter, a chemical that can cause an electrical event in the next neuron. So this neuron, this particular neurotransmitter, is dopamine, who is used in this particular occasion because the neurons can communicate like this with each other using many other substances. Now, this dopamine is sprayed in pulses, which last for milliseconds, and right after that happens, there is another event, a suction action, like a vacuum, who takes the dopamine back into the cell that produces it, so repackages it and use it later down the road. So this action of vacuuming the dopamine after milliseconds of having acted on the next neuron is blocked by cocaine. And as a result, there is more dopamine around, and the neuron in the nucleus accumbens believes that is a lot of stimulation coming from the ventral tegmental area. So practically the system is tricked into believing that something very, very good for the individual happened. Now, this effect is so powerful that laboratory animals will self-administer cocaine at the expense of food and water until they die. That's pretty much the only addictive substance that does that, that has this effect. Also interesting, human beings do not quite self-administer until they die of starvation or dehydration, but there is something specific about cocaine. It tends to be administered in binges that last for days or until the money runs out or the supply of cocaine runs out. So it's a very powerful reinforcer of this VTA, ventral tegmental area nucleus accumbens pair of nuclei. So powerful that you are compelled to use it until you run out of it or you run out of means to procure it. We talked about the good effects of the cocaine, the so-called good effects of the cocaine. That means giving you this rush. Now let's see what it does bad to the brain, because definitely it will not be a drug whose consumption is punished so severely by the society if there wouldn't be a bad aspect of its use. So what does it do? So as I said, it stimulates the ventral tegmental area nucleus accumbens, causing euphoria, but once it's gone, it leaves you in a state of withdrawal. And what does it mean? After the effect is gone, the people go through phases. In the first phase, they are agitated, depressed, experiencing extreme craving and not being able to sleep. After that, there is a phase when you do exactly the opposite. Depression still stays, but the opposite means that you sleep a lot, you eat a lot, and you feel pretty lousy. And after that, there is a normalization of the sleep, but with continuous cravings for cocaine, who can last for weeks. What happens to the brain, you can see that it visibly changes the brain. The acute event, the acute administration of cocaine will lead to vasoconstriction. The vasoconstriction will lead to a lot of bad things happening. First, you can get a very bad headache. But also, you can have one of these arteries burst inside the brain. Why is that? Because if you constrict a blood vessel and in the same time you raise the blood pressure in the rest of the body, you are going to have the high likelihood that one of these little vessels inside the brain will burst. And when that happens, you have intracerebral hemorrhage or subarachnoidean hemorrhage. The stroke, the what we call stroke, with a lot of negative consequences, even death. What else it can cause? It can cause encephalitis, a toxic encephalitis that usually leads to coma and very often death as well. It can cause transient ischemic attack, and TIA, or transient ischemic attack, means a situation where the blood vessels are so constricted that they mimic a stroke, but the symptoms, fortunately, are transitory. They do not last more than half an hour, and then they go away by themselves. Let's go a little lower. With the brain, another kind of big problem that can happen is seizures. Obviously, cocaine is a strong stimulant of all the brain, and when you are predisposed or when you have already a lowered seizure threshold, then the risk of seizure has become very clear. To the heart, what does it do to the heart? It speeds it up. How does it speed it up? It can cause sinus tachycardia or supraventricular tachycardia, or even ventricular tachyarrhythmia. These are just changes in the rhythm accompanied by the high rhythm, and obviously the worst of it is the ventricular tachyarrhythmia, which can go into ventricular fibrillation and death. Aside from that, it can cause a heart attack. It will constrict the coronary arteries that supply the heart with blood, to the extent that they will choke the blood supply and the oxygen supply to the muscle, causing a heart attack. They also cause cardiomyocytes. What does that mean? An inflammation of the muscle of the heart with resulting cardiac insufficiency, and very often death follows as well. If you cause the heart to start beating faster and beating irregular, you are going to have an increased risk of thrombi, that means of the blood coagulating inside the heart, and these little thrombi being spewed into the systemic circulation. As a result of that, you can have a thrombosis in the arteries of the brain with stroke. You can have a thrombosis in the kidney or in the intestines, or even in the extremities. You can have, even if you are already suffering of some peripheral artery disease, this kind of event, consecutive to cocaine administration, can lead to ischemia, an acute ischemic event in your extremities. To the vascular system, it can cause a generalized contraction, which leads to hypertension. Is not uncommon for the aorta, the biggest artery in the body, to burst. That's called aortic dissection. As a result of this stress, the combination of hypertension plus an increased heart rate, it can lead to the burst of the aortic artery, pretty much fatal in a very high percentage of situations. It can also affect the metabolism. In that way, it can cause hyperthermia and rhabdomyolysis. Rhabdomyolysis means breakdown of the muscles and with resulting kidney insufficiency, because the breakdown in the muscles means that in the bloodstream there are going to be a lot of big proteins that will choke the renal filter. What happens if you administer this substance to a pregnant woman? Well, problems with the placenta. Placenta may insert in the wrong spot, leading to a placenta previa. It can lead to a very problematic insertion of placenta with subsequent placental detachment and massive hemorrhage. It can lead to spontaneous abortion, malformations of the fetus, or neurodevelopmental delays once the baby is born, even mental retardation. I have been ranting and raving against cocaine, and in my opinion, I gave you pretty good arguments why you should not touch cocaine. But some of you might say, look, I don't have anybody who has a cocaine problem. I don't know anybody who has a cocaine problem. After all, why should I pay attention to this? What is the magnitude of this phenomenon? Is it really something that I must be concerned with? So that's a legitimate question. That means what is the impact on the society? How many people are using cocaine? This is where epidemiological studies can help. The cocaine use depends very much on availability, the permissiveness of the society to its use, and some genetic factors, because exactly like with the alcohol, the vulnerability to develop cocaine addiction has something to do with the genes, and I will show you how. Now, obviously, availability means amount and price. And this connection between an addictive behavior and the availability of that particular item is very clearly demonstrated, as, for example, the connection between alcohol dependence and the density of alcohol outlets in a certain community, or between obesity and the number of fast food restaurants in a certain area. So this is beyond dispute. The more amount of you have, and the lower the price is of a certain desirable substance, the more consumption you will get. Now, another aspect is permissiveness. For example, in Bolivia and Peru, the permissiveness is very high. People do not blink an eye when you see someone chewing coca leaves on the street. In other societies, the permissiveness is much less obvious. But within the same nation, there are pockets where is a big offense, or let's say an unacceptable behavior to use cocaine, and there are pockets, areas where this issue is not a big deal. Compare, for example, the rural areas of United States versus the urban areas of the United States. You might say, well, there are some cities that have very low permissiveness to cocaine use, and there are rural areas that have a very high permissiveness to cocaine. But in general, that's pretty much the rule. The higher the urban agglomeration, the more permissive this attitude is towards the consumption of drugs in general. So let's see, what are the numbers? We know the numbers. They have been followed for many decades, and we know that they kind of fluctuate between a low of 1.5% to a high, which happened in the early 80s, of 6.9%. And what do they mean? That means in the early 80s, 6.9% of this country within any given year of that beginning of the decade was dependent on cocaine. So these percentages means dependence on cocaine. If you think about the total number of people who are within a certain year dependent on cocaine, that's also the definition of prevalence, as opposed to incidence, which is the new cases of cocaine dependence appearing in a certain year of study. So this is the magnitude of the problem. Currently, the number is around 1.6% of the people of this country, United States, are addicted to cocaine any given year in the recent past. Now, why does it happen to some people and it doesn't happen to others? After all, if you take 100 people and you give them cocaine, only 16 of them will become dependent, and when you cannot say, but if you take a period of 10 years after the first use of cocaine, you will see that 16 out of 100 will become dependent. So if you take once cocaine, this is the risk that you are dealing with. The risk that the 16% chance that within the next 10 years you are going to meet the criteria for dependence. It may not happen the current year, it may not happen in 2 years, in 3 years, but if you look at the 10-year the frame, you will see that 16% of the people who try cocaine will eventually get addicted to it. So we were speaking about permissiveness and about availability, and I mentioned something about the genes. How do we know that genes play a role? That means the individual characteristics play a role. There is something like a vulnerability that an individual can have to developing this illness called cocaine dependence. How do we know that? There were some studies showing that if you have an identical twin who got addicted to cocaine, your chances of becoming addicted to cocaine are higher than if you have a fraternal twin who got addicted to cocaine. So you see the subtlety of this study. You look at people who have a identical genetic making, and the more not identical, that almost identical to a certain degree, like the identical twins, and then you have the fraternal twins, which have much less in common, and you see the risk of becoming addicted if your twin got addicted decreasing as you are genetically more distant from your twin. So now we talked about the ravages of cocaine, we talked about the impact on the society or the magnitude of this phenomenon, and now let's talk about something more optimistic, treatment. But as I will show you, the optimism is, let's say, cautious optimism. What can it be done? Medication, I'm going to dismiss this from the beginning. There is no medication that can help cocaine dependence. There have been numerous medications that have been studied, like dopamine stimulants, all sorts of antidepressants, monoamine oxidase inhibitors, Parkinsonian medications, even medications for psychosis or a cocaine vaccine. All have been looked at. None of them works at the time of this recording. None of them works. Maybe, who knows, something will come up later down the road, but as of now, forget about medication. It's not a medication treatment. Medication may play a role when you are dealing with intoxication or withdrawal, not so much withdrawal, mostly intoxication with cocaine. Obviously, you must do something medication-wise to help to save a life eventually. And what can be done? Usually beta blockers and alpha-adrenolytic substances, maybe anti-seizure medications are used in the acute intoxication, and sometimes even neuroleptics if you are dealing with an intoxication involving hallucinations or delusions. So what do you do for the main problem? That means the addiction itself. Let's say that you are no longer in an intoxicated state, you are no longer into a withdrawal state. What do you do to make sure that you stay abstinent? Well, this is where the optimist has to be a little bit tamed down. If you are looking at abstinence, if you define abstinence as complete absence of any use of cocaine, then the treatment results are going to appear rather disappointing. Does it mean that treatment makes no sense? Absolutely not. Treatments may not achieve abstinence in a significant number of people, and when I call abstinence, abstinence forever, but it can definitely achieve marked reductions of the use of cocaine, which are indeed worth the trouble, worth the effort and the money and the economic investment in this activity. So let's see how, for example, the studies that look at the efficacy of the treatment programs for cocaine dependence are varied. They are very heterogeneous. They involve a lot of parameters that they look at. But I'm going to give you as an example one of them who looked at the outpatient programs. And the question that this study asked was, how many people, what percentage of people after attending an outpatient program report a 50% or more decline in their use of cocaine? And if you look at the people who stayed in the program less than 3 months, that number is 58%. So roughly half of the people who attended the program less than 3 months will report a 50% or more decline in their cocaine consumption. The people who go to the outpatient program for more than 3 months, they will report in a percentage of 85% a decline of 50% or more in their cocaine use after the program. So you see it's a significant decline. There are inpatient programs showing that a person entering the program with a frequency of 17 days out of 30 of use of cocaine before the program goes down to 1 or 2 days per month of use of cocaine after the program. So it's definitely worth spending your time in a treatment program like that, because going from a massive consumption of cocaine to a modest consumption of cocaine is still can save a lot of lives and can save a lot of money to the society in general. Now, what kind of programs are out there? I just mentioned there are inpatient and outpatients. The outpatient programs are either the ones who are organized by professionals or just the self-help group of the model of AA. Of course, they are called NA, but in fact, the people who are dependent on cocaine, they can end up with any of those, AA or NA. It doesn't really matter. Now, the outpatient programs are more structured, and they are usually organized based on time, either for 1 month, for 3 months, or some run even longer than that. The outpatient programs involve a daily attendance, Monday to Friday, several hours a day, and some of them are structured in such a way that they allow people to have a job, so they are during the evening. The inpatient programs, they used to be kind of modeled by the 28-day inpatient treatment programs designed by Hazelden Foundation in Minnesota. They started with AA philosophy when they constructed this type of program, and they expanded it beyond alcohol to any kind of substance abuse. What I have seen is a kind of slow erosion of this program. Nowadays, I've heard of 21 days program, so probably some quote-unquote wizard from the managed care company, they looked at studies and concluded that 21 days program work as well as 28 days program. Therefore, what's the big deal? Let's no longer pay for 28 days, but 21 days. I don't know how nobody noticed that this is a gradual result. That means from 0 to 28 there is an increase in the results of the program. So obviously if you compare 28 days with 21 days, you are not going to see a statistically significant difference, and probably the next step would be to compare 21 days with 14 days and also not find any statistically significant difference. Therefore, kind of justifies this trickle-down approach to healthcare. But it's clearly documented that when it comes to cocaine, even a month is too little. 3 months is more likely to cause a substantial benefit. But now, 3 months, there is no inpatient program. That is already called a treatment community, another model developed in California in the beginning of 1960s. So what happens inside the program? Either outpatient, inpatient, what kind of philosophy? What are they doing? What are they talking about? Well, there are three main approaches, psychological approaches. One of them is contingency management. Now, contingency management is rather a controversial approach. It means giving someone something that they desire in exchange for a behavior that the program desires. What does it mean? At the most crass, the program will actually pay their participants to give them urine toxicology screens which are negative for cocaine. So participants are paid a certain amount of money every time when they give a negative urine toxicology sample. Now, urine sample. But again, we are not talking about asking the patients to go out on the street and bring a clean urine. They are definitely supervised to make sure that clean urine means actual no use of cocaine. So obviously nobody is going to agree with that. This idea of paying someone to stay sober is rather unpalatable to many politicians and many observers from the society in general. So these are never beyond a very small experimental group. But other forms of incentives, like vouchers for goods and services, are used, or even more frequent is access to housing and access to employment is used as a positive reinforcer. But contingency management doesn't mean only positive reinforcement. It also means negative reinforcement and punishment. Negative reinforcement means withdrawing something that is desired by the individual, and punishment means introducing something that is painful to the individual. Not necessarily physical, but it can be any kind of, let's say, stimuli that causes an adverse reaction. Now, the negative reinforcers are used in licensed professionals who are addicted to cocaine. That means withdrawing the license to practice a certain profession if you are found to be positive for cocaine. So these are examples of negative reinforcement. And of course, punishments, it's very well known, incarceration. That's the most common one. But if you are in Singapore, you might even get flogged in the public square. Not quite in the public square, I'm a little bit more dramatic, but that's what happens in Singapore. You may risk getting some whips on your back if we are caught using drugs. Dealing drugs is probably much worse than that in that justice system. But let's see. So this is one approach, contingency management. Another approach, very well studied, is cognitive behavioral therapy. This is practically the main form of psychotherapy that is happening in the United States, but it has some practical applications, is modified in a certain way to be applicable to cocaine dependence. And what does that mean? How does the program based on this approach function? Well, it has some components. The first one is a lot of psychoeducation. What does it mean? People are taught how the mind works, how the addiction works, how does it get this tight grip on the person, why is it happening, what are even the mechanisms, the biological mechanisms by which the cocaine is getting a hold of the individual. All of this are detailed in the psychoeducation part of the model. Then there is this idea of teaching the individual how to sniff out the dangerous situations. That means how to recognize from a mile situations in which they might relapse. It's extremely important skill. If you know that a party is going to involve cocaine, then you know, because of repeated psychotherapy, that you should not be there. Another skill is if the relapse happens, how to manage the relapse. What do? Do you go with all or nothing concept, like I tried but I lost and therefore I may go into a binge for a week? Or the concept of I stumbled but I'm not going to fall. I'm going to stand up and walk again in the right direction. So these little psychological tricks are taught again and again and practiced again and again in these treatment settings. There is another program another philosophy approach that I'm going to mention to you, although it doesn't seem to have the scientific backing of the CBT, but it's for some reason very widely spread, is the Motivational Enhancement Therapy. Motivational Enhancement Therapy. According to this approach, the cocaine addiction has, and in general addiction has 5 stages: pre-contemplation, contemplation, action, maintenance, and relapse. And the therapy consists in a special set of measures that is designed to target an individual according to the stage in which he or she finds himself or herself. There's an intervention for the pre-contemplation stage, for the contemplation stage, for the action stage, and so on. It's a useful heuristic model that remains still to be assessed in a more scientific way, kind of checked in situations of controlled studies. So, in closing, what is the message? Cocaine is a really, really bad idea. It will have an explosive effect on people's lives. It will cause a downward economic turn in someone's life. You will see a vacuum forming around you because nobody wants to associate with you anymore. You will see legal troubles piling up sky high, and you will see a lot of personal risk, either psychological or actual physical. So the good part is that you should not just accept this as a given. If you fell into this trap, you do not forget there are plenty of things that you can do to get yourself out of that.